So the people that have social anxiety are able to, go to a party, or get up and give a talk in front of people. So it just depends on the degree to which the drug has been very effective at quelling anxiety, or fear of flying, for instance. That would be another instance where you might use benzodiazepine. I've had this happen probably a dozen times. Someone says, either to me, a patient or a therapist calls up and says, "Can you tell me something? I got a patient, and I want to ask you a question about this." They've been on this drug. In fact, I just got this question like a week ago. One of my old colleagues said, "I got this lady, she's been on Serac, which is an old tranquilizer. She's been on it for 25 years, and she wants to get off of it. How do you do that?" And my first response is, okay, first let's talk about why she wants to get off. And the question is, are there side effects? And there can be. Okay, somebody's been taking it for 25 years, and now they're 65 years old, and it may be aggravating memory problems. Okay, that's a good reason to do it. All right, or they've had a hip fracture. You don't want to take any chances about falling again. That's another reason. But some people have been on this drug for 20 years, and the reason they're going to get off is because their friends and relatives or their doctor saying, "You need to get off this stuff. You can get addicted to this kind of stuff." And if it's been working and there aren't any side effects, then the question is, if it's not broken, why fix it? Okay, but there's a lot of reasons that people may want to get off. Okay, so they start to get off. You always do gradual withdrawal. If you start to get breakthrough symptoms and in your judgment, this is a return of the underlying anxiety disorder, then they've got three main options. Okay, one is to go back on the drug, obviously. Okay, secondly is to get them started with psychotherapy and tell them to, with their physician's blessings, let's put this withdrawal on hold here. Let's leave it at a modest level. Don't take them off it yet. We're going to get into therapy, and then maybe a couple of months from now we can begin to taper this off. Or the third alternative is to switch to an entirely different kind of drug. Okay, the best drugs for anxiety are SSRIs. Okay, but here's a couple of other possibilities, and I'll just mention these and then we'll take our break. Okay. If it's generalized anxiety, then Buspar is certainly an option. We'll talk about Buspar. It's not a benzodiazepine, okay? If it's generalized anxiety, Neurontin can work for some people. And then finally is Atarax or Withdrawal, which is these are antihistamines, okay? So the options then therefore are to go back on the drug, stay on the drug at low doses, start psychotherapy, or switch to a different class of medications. And I would always want to know what are the main reasons for saying that you want to stop. But let me warn you, there's a lot of moralizing about this. Well, you shouldn't be on that drug. Oh, that's addictive. Well, it is for some people, but like I mentioned in our last class, for some people it's not. And there are some of the experts have written about this. It's not just a personal opinion. That this is where clinical judgment sometimes stops and you get into moralizing about what's right and wrong. And sometimes there are people who have had debilitating, severe generalized anxiety that was ruining their life. They got on a tranquilizer 15 years ago. They haven't increased the dose. They're not abusing it. They're not having side effects. It's working. And so why would you arbitrarily say, you got to get off that drug? You know what I'm saying? Okay. All right. Now, I'm not a big fan of benzos, okay? I think there's a lot of other ways to go about doing this, but there are appropriate uses for the drugs as well. Okay, so we talked about benzodiazepines. We're still talking about classes of drugs, right? Buspar is next. Sometimes people jokingly refer to this as Prozac Light. It has some kind of different mechanisms of action, but it tweaks the serotonin system. It's referred to as an atypical tranquilizer because it's completely unlike benzos. It's not habit-forming. Also, benzodiazepines all are anticonvulsant and muscle relaxers. Okay, so Buspar is not an anticonvulsant. It's not a muscle relaxer. Okay, but decreases worry. And it doesn't have a direct effect on physical functioning. If I have a lot of anxiety, if I take a tranquilizer, within an hour, I'll physically feel more calmed down. I won't be trembling or rapid heart rate or something like that. But here, you can take Buspar for several days, you won't feel anything. but usually after 2 to 4, but sometimes it takes longer than that, weeks of taking it on a daily basis, people will say, you know, actually, I'm just not worrying as much. And so it seems to have an effect on cognition. Now, what's at the heart of OCD is ruminating, but also with generalized anxiety, there's kind of a variant of that because people keep worrying about the same stuff over and over again. And so when you increase serotonin or tweak the system in some way, it appears to diminish ruminative behavior. It does not work with panic attacks, so forget it. Because it takes 2 to maybe 4 to 6 weeks to really work, you never use it for acute anxiety problems. So why would you use it? Well, one thing is it doesn't have nearly the side effects that SSRIs do. It doesn't have any sexual side effects. Doesn't cause activation that we talked about before. So if I had generalized anxiety disorder and I wanted to deal with it just, with medication, I probably would choose this first because over the long haul it has fewer side effects. But also, about half the people that take it, it just doesn't work very well. And so, but here's something that has very few side effects. It reduces worry, so why don't they just put it in the water supply? I mean, it sounds good to me. Okay. Antidepressants. Any of the antidepressants actually except Wellbutrin, because all the antidepressants, the newer ones, target serotonin, and that is the neurotransmitter that you're trying to have an impact on that has anti-anxiety properties. And you may get a somewhat quicker response to the anxiety reduction of anxiety symptoms than you do to depression. All right. Wellbutrin actually can throw gas on the fire, and I got to tell you, I've seen people, panic disorder and some depression, and they're on Wellbutrin and Ativan or something. It's like that doesn't make any sense at all. Again, not a personal opinion. Just go to any psychiatric textbook. Wellbutrin increases norepinephrine. Wellbutrin increases dopamine. Those are excitatory. So Wellbutrin is not the way to go. Okay. Always, again, got to watch for activation. And this group already is anxious, so it can make it a lot worse. Okay, now in terms of dosing, you're using a similar dosing as you would with depression. You want to get by on the lowest dose that works, but if the starting dose doesn't work, then cranking it up again makes sense. The one exception is that with OCD, oftentimes it requires doses that are quite high. Now, there's every reason to believe it's okay to start at a low dose, but you may need to go to top-end dosing like 60 milligrams or even 80 milligrams of Prozac, for instance, which you would rarely need to do, with depression.